Days are still counting, with the pandemic wreaking havoc in the nation, devastating different sectors in the country. But how are Kenyans behaving during this time of the pandemic?
The coronavirus crisis has placed many things under an unforgiving spotlight, including economic inequality, the vulnerabilities of healthcare systems, and countries' approach into fighting the pandemic. The virus is surging daily, with the death toll rising in many countries, sparking fears that the situation might be worse if a cure is not found. Economies have been devastated by the pandemic that has wreaked havoc in many countries, leaving many suffering in silence. Hundreds of millions of people have been left jobless, as many businesses have been brought to a standstill. The UN's International Labour Organization predicts 1.6 billion informal economy workers could suffer massive damage to their livelihoods. This is one of the busiest markets in Kenya's capital city, Nairobi. Like other typical mornings, hundreds have flocked here to make ends meet. Meet John Nzoli, and one among many who are facing the harsh economic times resulted by the deadly virus.
Mimi naitwa Jonte, jua kaa jina langu ni Jonte ama Masai. Mimi kuwa student Talanta. Nilikuwa music production, lakini unacheki vile saa corona ilikuja, shule zikafungwa, ilibidi tu ni hustle likakosa, unaona. Alafu bado nilikuwa nafanya set books, hizi kuact set books, but saa shida mastudio alikuja home, so like job yote ikaenda chini, hakuna place na kulia.
One who made good money is now struggling to make $3 on a good day.
So ikabidi mimi nikuja tu soko huku hivi na nauza tundimu hapa hivi, alafu nikipata mtu nitabebea kama mzigo na mbebea, tunaenda hivyo, ananipea tu ile kitu kidogo. Unajua si tunatafuta pesa mingi, ni ile tu kidogo, ile tu ya kuendelea tu, unaona, ile kujikimu tu, upate chakula, pesa ya nyumba na fare tu, like hivyo kusurvive.
It's not an easy task.
Challenges tuseme tu like wezi si ati ni mob, like si ati kaa kitambo unaweza sema pesa ilikuwa mob. Unajua ulikuwa umezoea job inalipa, like unapata 1000 plus 1,000 per day. Basa huku unaweza kuja upate per day unapata kaso 3 hivi so 4. But ina shida tu, inabidi tu tukazane juu obvious kuna watu hawapati hiyo, so inabidi tu kubali, unaona. Ni hivyo tu like, but siwezi sema ni challenges more, but enyewe tu inabidi nukazane tu.
With the pandemic overturning life a question, many have been left in uncertainty, with thousands left at risk of succumbing to hunger, another silent killer that has pushed many to the edge.
Schedule yangu niamke saa 10, saa 10:30 niko nimepanda gari. By 5 nafaa kuwa soko. Nikikuwa huku by 5 like ndo wase wanafungua job, na changamka sasa, naanza kuwafungulia tu job. Naweza fungulia mtu anipe kachwani hivyo, nisaidie mwingine kufungua. Like ile time wase wanakuja kununua vitu, ndo ile time saa mi like wakiingia na kaba hiyo matime ya rashao, inaitwa masaa ya rashao, yani masaa ya pesa, unaona. Sasa siwezi sema gava kwanza. Obvious unacheki wezi angalia gava. Ukiangalia gava sana utaumia jo. Sasa kwanza ujitambue, uchape hustle yako. Place utafika na umeendelea ndo utaendea gava. Juwezi depend na gava sahi.
A survey by Tifa Research Firm shows that stigmatization is still a challenge in the fight against the pandemic. The survey revealed that 23% of Kenyans are not willing and cannot visit people who have recovered from the virus. According to the World Health Organization, stigma can undermine social cohesion and prompt possible social isolation of groups. Meet Dr. Purity Kubai, a teacher and a guidance and counseling expert. She explains the dangers of stigmatization against people who have recovered from COVID-19 pandemic.
My name is Dr. Kubai Purity. I am a teacher of religious studies at Park University in Nairobi, Kenya. I am also a holder of counseling psychology, where I deal with counseling of families, of the youth, the children, and all who need those kind of services. I am also a director of Ponwes Academy in Ruiru, sub-county in Kiambu County. With all that, and against the backdrop of what is happening here in this country today and the world over, the COVID-19 or the coronavirus is something that has come and shocked all of us in Kenya and the world over. The effects of stigma to those who have been affected cannot be underscored enough, because these people have been shunned by the society and by their very own, notwithstanding the fact that this is an illness and a disease like any other that has spread all over. So we are having people who feel as if they have been marginalized, they have been locked out, nobody wants to talk to them, nobody wants to interact with them, nobody wants to sell to them, nobody wants to be with them even in places of worship, and indeed, even some of the family members. So the effects are far-reaching and they are untold. And that is the effect of the COVID-19 to those who have been affected. And yet, we know that even if one is not infected, people are affected in different ways. And therefore, there is need to cushion them, understand them, and also help them to live lives that are as normal as possible, especially in the social setting, in the spiritual setting, in the economic setting, in the emotional setting, in order to make their lives go back to normal. This has become a new normal where people are working away from the offices and therefore working from home, where the institutions of learning are not in session, and therefore our universities, our colleges, our high schools, our primary schools, to mention the education system, are also not in session, and therefore the families, the children and their parents are at home. And yet, even at home, people are supposed to observe the same protocols that we talked about earlier, in as much as when we talk of livelihoods, some of the parameters might not be adhered to. But all that said and done, there are areas that can be observed, like the washing of hands, the wearing of masks when people have to leave the houses, and so on and so forth. That might not be the hardest thing to do, but now people have found themselves interacting in such a way that the parents are home, and it's like they are keeping an eye and a watch over the children. The youth and the teenagers are also at home, and they are not used to having their parents on a day-to-day basis because they are in schools, they are out there with their friends, and here they are now confined within the walls of the homes. And this has brought up a number of other issues where some families are already fighting and in disagreement because they are not used to being together. Spouses, fighting spouses, even some have separated during this time. The children and the parents not understanding each other because everybody wants their space and their freedom, and yet now they are together in their homes. This has brought a lot of conflicts. And yet, to the contrary, they should be bonding and coming together as family and use this as quality time, unlike when they have been separated because of work, because of school, and because of other responsibilities. And yet we are seeing the opposite, where we have a lot of conflicts, a lot of misunderstandings, a lot of finger pointing, a lot of blaming each other, and a lot of falling out. And it is our hope that this becomes an eye-opener as to the need of the families having and creating more time socially to be together, to bond with each other, and to use every available time to come together as families and to live with each other. Thank you.
With many Kenyans still ignorant, while others remain skeptical to the fact that the virus is here, face masks must be worn properly as per the instructions of the World Health Organization.
So mimi naweza sema tu kitu moja, hivyo sikizeni tu gava vile mnaambiwa, social distance, like kusanitize, acha kudharau ati ujiona mtu amepata corona ati huwezi vaa mask. Vaeni mask, usiogope. Alafu social distance, like hivyo tu, like tujaribu kujichunga juu. Jichunge, chunga babako, chunga mamako, chunga bradhako, sistako, hivyo tu.
It is a period of time when thousands are suffering in silence with job losses characterizing different states around the globe. The Minister of Health is calling on Kenyans to remain vigilant, as this is what will reduce any potential exposure to the deadly virus. Mark Kim on the 4 Light Up TV, Kenya's capital, Nairobi.